All right, let's look at the next story. We have reports reaching us that the federal government has announced a set of reforms that are aimed at strengthening the regulation of healthcare facilities across the country. Now, Dr. Tunji Alausa, the Minister of State for Health and Social Welfare, disclosed this on Thursday in Abuja at the inauguration of medical laboratory regulation and inspection against quackery in Nigeria. Now, Alausa said that the move came in response to growing concerns over unregulated and substandard healthcare services that have plagued the country's health sector. Now, he emphasized the importance of ensuring that all healthcare facilities, particularly laboratories, adhere to stringent standards. The minister highlighted recent revelations that illegal kidney harvesting rings operating in Abuja and other parts of the country, underscoring the urgent need for comprehensive oversight. To address this gap, the minister announced plans to establish a national health facility regulatory agency, which will be tasked with monitoring and regulating all healthcare institutions in the country. The establishment of this agency will be a significant step towards our efforts to protect the health and well-being of Nigerians. We will ensure that the agency is equipped with the authority to shut down any facility that fails to meet our standards, thereby safeguarding the public from harmful practices. That's what he said. But this is another agency that has been set up towards making sure that the policies in the healthcare sector in Nigeria are being kept, and followed and productive. So how do you see this in curbing the menace of the issues that we have regarding healthcare?
Health is wealth, but common sense is not common. Why? Because I always like to refer to the definition of insanity by Albert Einstein when he said, doing the same thing over and over again and expecting a new result. We've heard a lot of these stories of agencies, oversights, actions. If you look at George Orwell's book on Animal Farm, when he said, all animals are equal, but some are more equal than others. The political class and our leaders, they understand the importance of health. Why? They always take the fastest flight out of the country when they have a little ailment. So they understand that health is very critical, not just to the economy, but to the survival of the nation, of the people. It is critical to the productivity of that nation. Because if you're sick, you cannot be productive. You'll be trying to get yourself rescued. So now they're talking about the creation of an agency. Beautiful. That's beautiful. But who will man those agencies? Human beings. And if you don't have a transformed or reformed minds or people manning those agencies, you will continue to get the old result and the old way of doing things. Because we're talking about oversight as a result of cases of people's illegal health, kidney harvesting, substandard health facilities, fake drugs. Many of our people are dying as a result of fake drugs. Nigeria was blessed with people like Dora Akunyili, may her soul rest in peace, who was a champion for the protection of the citizens of this country through, ensuring safe drugs. Now, the oversight we are not seeing much of the oversight. That's the truth. You can walk up to buy, most of the drugs people are buying, some of them don't even check the expiry dates. Some of them are expired. And they're taking those drugs and they're dying. So, establishing an agency is beautiful, but we need to have reformed minds to man those agencies, because one of the obstacles to the oversight is money side. When there is money in sight, there is no oversight. So the money has blinded them from doing the right thing.
All right, they might feel this is the right move, but we need to get the minds of the people, reformed. Let's get your thoughts on this new agency being created.
In Nigeria, our problem has not always been policy formulation. We have very wonderful and brilliant policies that are formulated, but our greatest challenge has been at the implementation stage. We hardly implement policies that are formulated. And when you formulate policy and you implement and follow it to a logical end, that's where you get results. So for me, it's a very brilliant and laudable idea by the minister and coming from whoever that has presented it. Because whether I like it or not, we need to eliminate quackery. We need to eliminate substandard people doing any field that they are not properly equipped to do. Then, if you look at this agency to also regulate, by the time you set them up, they need to be funded. They also need to have that political will to carry out whatever they want, their functions. Well, if you have the political will, you have the right funding, and you're properly equipped, and you are also, you also have a wonderful synergy with security agencies to back up, because whether you like it or not, in terms of regulation, you also need to move, you also need to make arrests, you also need to prosecute, so that it will serve as a deterrent to others who would want to. Because if you catch some people or you apprehend and just give them a slap on the wrist, you encourage others to do. But if someone is properly punished, jailed, to serve as a deterrent to others, you discover that most of these things will.
You know, that's a very huge one, because we've had cases of some of these people being caught, and then at the end of the day, you see that bribe or, you know, money exchanges, and that's the end of the case. We've had so many cases like that. But when one sees this agency, the first question one would want to ask is, all the while, does it mean there was no body as in organization or agency to actually regulate the activities of these healthcare practitioners? Does it mean that we have not had this in place all the while? If we had, then what were the failures and what were the successes of this organization or this agency? And then why do we need a new one if we already have it in existence?
Maybe the ones they have, it's either they're not doing their job or nothing like that has been in place. They say necessity is the mother of invention. So they must have seen, they must have heard what's happening, so they need to come up with something to put a proper check on it. Whenever a man wakes up from sleep, is assumed to be his or her morning. So let's just see how this will see the daylight of fulfillment. All they just need to do, this agency that has been set up, is to fund them properly and also equip them with the adequate manpower. Then they engage in wonderful collaboration with security agencies. Then they'll hit the ground running. And I believe that at the end of the day, they'll put an end to quackery.
Because the bodies that we have had, we've had organizations, we've had the PSN, Pharmaceutical Society of Nigeria, I've had them on my show. And I've had them tell me how they actually go after these people themselves. They've talked about steps that they have taken, you know, even the NMA and things like that. So putting up a body now that will be their responsibility, what are we expecting?
First, they have to be properly funded. Once they are funded and equipped, there's no way they won't work. One thing is to set up an agency. One thing is to set up a body. But if they are not funded, they remain comatose.
You know, that is even the case that we hear from a lot of other agencies in Nigeria. What is the assurance that this will be different?
It depends if there's going to be sustainability, right? The next government coming in, if they can sustain this beautiful program. One of the major challenges we are faced with in our country is lack of sustainability. When the next government comes in, rather than sustain the previous good programs, they want to scrap it off and start their own. Leadership is all about sustainability. Sustain the good for the people, because you are there to deliver for the people, the dividends of democracy. And if you're talking about the dividends of democracy, why will you be scrapping off taxpayers funded projects that is focused on alleviating, improving, empowering, and enhancing the livelihoods and the welfare, in this case, the health of the people? So that's a faulty aspect of leadership, or a faulty leadership, or a defect that we need to correct. It all falls on leadership. So even the health sector we're talking about, leadership. If you have the right leadership, it will be properly run. People will do things rightly. There will be standards, and they will maintain the standards. They will adhere to the strict standards, because every life matters. And both the doctors, the health workers, everyone, the ministry, the officials, the government agency, the regulatory agency, they will all work together understanding that the life of a Nigerian citizen matters.
How much attention from your analysis would you say that the government has placed on health? Deima, let's start from you.
As a teacher that I am, if I'm giving my student a score, I will score him below average, because look at the statistics, look at the facts, look at the records. This is not just a statement or a fiction or an imagination. Our mortality, maternal mortality rates is among the worst in sub-Saharan Africa. Many of our women are dying during childbirth that could be prevented. We still have a lot of Nigerians dying from preventable diseases like cholera, like diarrhea, food and waterborne diseases, because they don't have access to clean water. So this is the 21st century society we're talking about. After over 60 years of independence, a large percentage of our population still don't have access to clean, safe water. We're talking about health.
That's where health even starts.
That's exactly what we're talking about. If the people cannot have access to clean water, look at the Niger Delta states, for example. We have rivers everywhere, water everywhere. Even a famous Nigerian musician sang that water everywhere, but yet the people don't have water. So if you're talking about health and water, these are basic things, and we cannot, health is very broad, right? I always refer to the definition. When I was in secondary school, I learned about the World Health Organization definition of health. That is not just the absence of disease, but the complete state of wholeness, right? So because you don't have malaria does not mean you're not, you might be mentally sick. Now, health is broad. Let's talk about water. We're having cases of cholera outbreaks and people are dying. Now, recently we're having monkeypox cases, and the World Health Organization, they are working to declare, in fact, they have declared an emergency, a global health emergency. What steps is the Ministry of Health taking place? Even carrying out sensitization to the rural areas to sensitize them on this monkeypox outbreak? Or are we waiting until it becomes a national emergency or a disaster before we react?
That's true. A lot of people don't really know.
So that's what we are talking about. Where are the health workers being trained for a response for cases like monkeypox? Are they receiving professional training? Are we setting up emergency centers that can handle cases of the monkeypox? Are we collaborating with the 3 tiers of government, the federal, the state, the local, with international agencies, the World Health Organization? Are we working with the universities, carrying out sensitization in campuses? We are not taking health seriously in this country because we have not seen it as a top priority.
Well, that's also your stance on this?
Yes, when you look at the budget annually of both federal and state government, how many percent of the budget is allocated to health? That's where you will even score their area of seriousness. If you look at our budgets the last 5-6 years, how many percent of the budget goes to health? It's either capital expenditure, recurrent expenditure, and few to either health and education. So the government already, they have downplayed it. They have not taken it serious. And whatever you don't take serious, that's the kind of result you get. Not until they place huge emphasis on health. And health is very broad.
Yes.
It has to do with disease control. It has to do with infrastructure. It has to do with training of personnel. How many percent of the budget goes to health annually? If you tell me how many, then we look at it holistically.
But the health professionals and health personnel and those in charge have been complaining about the same thing. They have written, if you're talking about writing, they have advocated, if that's what you want to talk about. They have threatened to go on strikes and they've gone on strikes. A lot of them are leaving Nigeria. They have done so much to call the attention of the government to that particular aspect, and knowing that they're not well paid from their statements, and then from the budget itself. And it doesn't even meet the world standard that we agreed to keep regarding the percentage that will be allocated for health in the budget.
That's why I say the budget speaks volume of the seriousness of government when it comes to health. And it's open. Anything that is anything that is in public domain, you can assess it. So for me as an individual, we look at it from the rational and holistic point of view. Health workers are living in droves. Our healthcare facility, how much are they spending to even maintain the existing ones, not even building new ones? All we hear every day is that building roads from here or from Lagos to Calabar They are doing another one from Lagos to Sokoto. These are not what we need. It's people who are alive, people who are healthy that will ply those roads.
All right. But then, if we look at the economy, the state of the economy now, do you think that from where we are at the moment, we can actually increase the health, what is actually slated for health in the budget?
Of course, we can. You know that how many % of our budget goes in for recurrent expenditure? And what is recurrent expenditure? Cost of governance. You and I know that cost of governance is so high. Let's take it down from the local government angle. A local government chairman has a retinue of SAs, PAs, executive assistants, and they call it empowerment. But in as much as they call it empowerment, these funds should have gone for existing facility. From just the channel it to education, channel it to health, channel to security, and otherwise we wouldn't be in this state.
But the government is not seeing it that way. We've mentioned it, even during the protest, was one of the demands. But from the response of the president, it's not looking like we're cutting down the cost of governance anytime soon.
And that's our major
So what then is our fate at the moment?
That's our major problem.
But
come to tell you again,
yes.
In Nigeria, government or politics, like I say, is not supposed to be an occupation. It's supposed to be a vocation. And once it's a vocation, that means you have something you're doing. Now going into politics is like going to serve your people side by side with your vocation, because you have what you're doing. So you're doing it on part-time basis, and you don't get paid fully. But
imagine the president doing it on part-time basis. Or are there particular politicians you're making reference to, or positions you're making reference to?
From the National Assembly down to senators. I mean, National Assembly, you have the commissioners, you even have, in fact, cost of governance generally.
What difference would that make?
It will make a whole lot of differences, because the funds that are being used to service these people, you can also channel it to other areas of the economy. And a senator earning over 30 million naira or thereabout a month, what is he doing there to do? To sit down and talk. And all the things they've been saying since 1999, how many?
21 million naira was stated by that particular lawmaker. Deima, do you see the government even considering that at the moment? Because I know that we have clamored for it even during this recently ended protests. But we've not heard any response on that in that angle. In fact, we heard that the lawmakers, some of them earn 21 million naira and above from reports.
You know, there's what is called selfhood and there's what is called nationhood. Right? Those two things are different. Now, when you sum up all we're talking about, you can sum it up to selfhood. Selfhood is for yourself, by yourself, everything focused on yourself. Now, democracy, government for the people. Now, selfhood is for yourself and yourself alone. I am not saying you shouldn't prioritize yourself. Now, we're talking about the government's response as it affects the health and everything that has to do with improvement of the health. If it does not affect them, it does not affect them. If it affects them, they will take it very seriously. So that's why we need to build good leadership. And how do we start it, right? How do we restore our country? How do we take it back to a shining light in Africa? Nigeria, during the time of independence, was a shining light to other African countries. Many countries, not just in Africa, many countries in what is referred to as the third world, looked up to Nigeria as a voice. And we had so much potentials that we were advocating for the independence and freedom and emancipation of other African countries that were still under the control of the colonial masters. But where is Nigeria today? How do we restore Nigeria and bring back her voice? We have lost the voice. Why? Because we don't even have power supply. So how can we have a voice? Other African countries are describing us today as the generator republic. We don't have functioning healthcare system. Yes, our healthcare system is not functioning. Our politicians prefer traveling to European countries and other parts of the world to seek medical treatment. Of course, there are some particular ailments that you might need the foreign expertise abroad. But primary healthcare system that can be accessible by all classes of people, the poor, the rich, those, especially at the rural areas, rural healthcare. It's nothing to write home about. Even when you go to some of the primary healthcare centers, no maintenance of the facilities. The infrastructure is broken. So people are not being sacked for that. People are not being relieved of their job. There is impunity and incompetency that is swimming all over the country. So until it affects them, but the way out, I always like to add that, the way out is we need good leadership at all levels, right from our home. Not we having this selfhood over nationhood.